Jackie Cameron for Biz News. With me is Professor Leonard Jason, who is a professor of psychology at DePaul University in Chicago. Welcome, Professor. Thank you very much for joining us today.
Thank you. Happy to join you.
So, Professor, you've produced a very interesting journal article on long COVID, and this research was reported on by the Wall Street Journal and various other media organizations. Could you perhaps start by telling us what made you just decide to do this research, and how does it tie in with your speciality, which is psychology?
Yes, for about 30 years, I've been studying an illness called ME/CFS, which is something that some people refer to as myalgic encephalomyelitis. Some people refer to it as chronic fatigue syndrome. And this ME/CFS illness often starts off with a person having a virus, usually Epstein-Barr virus, getting mono, and then not recovering. So that's a group that I've been studying for many years with basic epidemiology and prospective long-term studies. And when COVID-19 emerged around the world, I was pretty certain that there would be a certain number of people who got exposed to this virus who did not recover. And that's why I thought that it might be a good idea to basically be able to see some of the characteristics of what these so-called long haulers are, people who've gotten the COVID-19, but then over several months or longer have not gotten over their symptoms.
So many people who look closely at COVID say that it's mostly people over the age of 70 who die from COVID-19, and these are the people at greatest risk. Are you finding that this is also the case with long COVID, that it's mostly older people who are affected by this?
Well, that's a good question. We find people who have been affected by COVID and not recovering in all age groups. We don't have the data analyzed yet to actually indicate whether that's the same case with older individuals. We do know, as you all are aware, that certain individuals who are older, people who have immune difficulties, people who have diabetes, obesity, those types of conditions tend to be more likely to get COVID-19. Now, the key question is, are some of those groups more likely to not recover? And that's something that we're hoping to research over the next few months.
How serious is the psychological aspect of long COVID? Does it cause depression? And if so, are there different grades of depression?
So I would say that COVID-19 is a pandemic. It affects everybody, those who basically have it and those who don't have it in Great Britain, your country, and my country, United States. So that the fact that you've got this lockdown occurring really makes more difficult to have social interactions, particularly with the holidays coming up with December and November. So lots of people like to get together, and they're being told that might be a risk factor for family celebrations and friends celebrations. So yes, there's a lot of isolation that's occurring throughout the world, and particularly our two countries and others. And certainly social isolation is an incredible risk factor for all types of negative outcomes. I'm not sure if you know, but social isolation is really just about as damaging as tobacco as a risk factor for later health problems. So it is serious. It is occurring with everyone. And then if you have on top of that, having an illness that knocks you out and makes you miss work and family opportunities and social activities, that becomes problematic. If you don't recover from that, the so-called long haulers, then that becomes even more serious. So yes, anytime you have a chronic illness, regardless of what it is, whether it's cancer or something else, you do have often individuals who have emotional reactions to that. And sometimes it does occur, things like depression.
And this type of depression, is this something that psychologists can help with, or do we need different types of medicine? Is it something that we can work through by talking to other people? Or, is there something chemical that changes forever or biological that changes forever?
So I think it's important to differentiate something called demoralization from depression. A person might be demoralized. They might basically feel that they're not getting support from family and friends. They're not getting their business associates or workers to appreciate the fact that they have significant fatigue and different issues, in the long haul. So to the extent that you don't get support, that could be something very different than depression. And in those situations, hopefully, we can do some education to the public to be more supportive of these individuals who have continuing persistent symptoms. However, if a person has what's called classic depression, they have something usually that's called self-reproach. They have negative feelings about themselves and negative feelings about what they might want to accomplish. So if you have clinical depression, whether it's for COVID-19 or whether it's for the lockdown that's occurring, it's much better to get some help from either self-help groups or professionals to get some, to deal with that than it is to use not effective coping strategies, which involve things like substance use or eating or other types of activities like that can get one in trouble. And I'm saying not eating, not any eating, but basically if you do too much eating, too much of a particular activity, that's the problem, of course. We don't want to see people become obese and then have a risk factor because of that.
So what do we know so far about this long COVID based on your research? I see that you went back as far as the Spanish flu of 1918. How did you do that research and draw conclusions for today?
Sure. Well, there's been many articles and many books written about different viral episodes, whether it's Ebola virus or the influenza of 1918. And many others. And what we have learned from looking at the observations of these different viral attacks that occur periodically, SARS is another one, as you probably are aware, a certain percentage of people never recover. And that is interesting. Why is it that certain people are able to get on with their life and able to go back to their family and work responsibilities, and others are not? And that's a very significant issue for us in society, and for the working environment too. You don't want to lose those capable people who contribute to society. So yes, that has happened over the last 100 years with these different viral epidemics, and it's not unusual for a certain percentage of people to not recover, and it's very well documented.
In your paper, you talk about the cytokine storm. Why is that of such importance to you?
So cytokines are proteins, and they can be pro-inflammatory. And what they can do in some ways is have like a storm. And in that storm could potentially produce some of the cognitive problems. People have memory, people have difficulties concentrating, people have difficulties remembering things that they could before. So these types of things are cognitive problems. And it's very likely that if you have a storm brewing in your head of these pro-inflammatory cytokines, that could be one of the reasons for having these particular symptoms. So it's a very important area of research, something we need to know more of. We're very interested in looking at brain activity and trying to understand what has gone potentially wrong in the brain when these types of viral assaults occur.
It's quite a frightening concept that you'll never actually recover from this disease. Do you have any idea of how many people are not recovering or unlikely to recover based on your research of other viruses?
Well, yeah, I mean, think of it yourself. If you had the worst case of the flu and you can sort of take it for a couple of days, but just imagine if you can continue to feel that way for weeks. you can imagine how upsetting that would be. Now, there's two types of cases. For some types of individuals, they have clear organ problems. Their heart doesn't work as well, their lungs don't work as well, so they have something they can attribute their difficulties to. But for a lot of people, they come to their primary care physicians and they can't find anything. And that becomes very tough to, in a sense, tell your healthcare workers and your family and coworkers that you don't know why you're sick, but you do feel sick. And in terms of, what percentage, Tony Komaroff, said it could be 40 to 80% of people seem to have some persisting symptoms. That's quite a lot. So there's a lot of people that have some residues of this illness. I would say that I would not be surprised if over, a period of time, the ones who are really significantly affected might be about maybe 10%. We certainly don't know that number now, but looking at past epidemics, I would say that that's a very likely figure.
We spoke to a professor last week who mentioned that there's research that suggests that 1 in 4 young people in the US have had suicidal thoughts. What is your perception of how COVID-19 is affecting the psyche of younger people?
Well, I do think that, mental health problems are not uncommon. They affect a large percentage of people. Usually it's alcohol and drugs, which is the most primary type of mental health problem, excessive use that damages one's life. But depression and anxiety are also kind of high up there in terms of affecting lots of people. So yes, these types of epidemics, whether it's the lockdown or whether it's just having the illness, are going to take a toll. And yes, there is higher episodes of these types of things occurring. And as they occur, it's possible that some of these individuals who have multiple issues might kind of decide to end their lives. And we should do everything we can to prevent that, certainly. And we need to, as friends and professionals, do all we can to hook people up with the services and the ability to instill hope and instill that things could potentially get better, and have plans worked out so that one can, if things get bad, one knows where to call or who to bring in to intervene to try to disrupt a suicide attempt.
So, and just generally, then, what kind of coping strategies do you suggest, for perhaps parents of teenagers? How do you engage with your children who are tremendously frustrated with how their lives are maybe not panning out? They're not socializing. They're worried about, perhaps they're not actually, young people are not worried about contracting COVID, but they're worried about the sort of the broader economic consequences of what it means for their careers and studying. How do you suggest parents and teenagers engage with each other?
Well, it's difficult. Certainly, a lot of youth are used to going to school and socializing. As youth are getting older, they go from maybe 12 to 13 to they're 17. They spend more time with peers. When they're younger, pre-12, 11 years of age, they're more connected with the family. So for the younger ones, the family can continue to provide opportunities in the home and maybe the immediate surrounding area to basically continue to learn and continue to stay up in one's studies. The older youth, the ones who are in their 13, 14, 15, it's tougher because those individuals are used to socializing and they're beginning to break away from their families and develop social links with their friends. So they're going to want to associate with friends. And I would just say that we need to be very careful that youth don't, for example, go into areas where they congregate very in tight areas so that, particularly indoors, where they can spread the COVID. Because yes, they might become COVID positive and then they can give it to other people. So we need to encourage them to practice social distancing, to wash their hands, to wear facial masks. And it's a special duty for us to work with our youth. And remember, don't just take something away. If you take something away, it has to be replaced with something. So you have to have other enjoyable activities that can be instituted to keep them interested in the world. So yes, it's a challenge.
Earlier on in our chat, you mentioned that social isolation is as devastating as smoking tobacco for your health. Can you elaborate on that, and also perhaps give some ideas on how we can help people we know who are living on their own, but can't socialize because of the rules?
So yes, meta-analyses, what these are is like large groups of studies that have looked at this, have found that social isolation is really an incredible risk factor. So what's going on in the world is really, in a sense, contributing to the fact that we are less connected with others because we're careful. So you walk down the street and someone that you might have known before, walks on the other side of the street to sort of avoid you. Or just kind of says hello, doesn't really want to talk to you because they're afraid. That those types of experiences are being replicated throughout the world of, people are just not connected as they once were. So yes, we have to do more activities that could involve calling someone up on the phone that you haven't talked to for a while, making a Zoom call, having maybe a support pod of people that you can count on and regularly contact. So I think we have to initiate activities. It could even be that you check in with people yourself by calling or Zooming or Skyping, so that you, in a sense, become the ambassador to caring about others. If you care about others, you will then basically care about yourself.
Thank you. Before we close off, what's next for your research? Where are you taking this paper?
So right now we are kind of looking at individuals who had COVID and now are now struggling with it, and looking at their symptomatology and comparing it with people with other fatiguing illnesses like ME/CFS, lupus, post-polio syndrome, and we are MS. We're trying to see how it ranks with some of these other disorders. We're also doing prospective research where we have a large database of over 4,500 students who gave us blood samples and self-report questionnaires, and we're now going back and contacting them, and that we'll be able to see those who develop COVID versus not, where there's some predisposing factors that help us understand this illness.
So am I correct in understanding that a lot of diseases, there's a strong link, for example, between lupus and depression, or MS and depression? Is that where your interest lies?
So yes, it turns out that lots of these autoimmune diseases basically, or any chronic illness, is going to increase chances of us having some type of psychiatric problems. So I'm interested in psychology of the mind and the body, because we can do things to enhance our immune system and fight our ability to get COVID by doing some really basic things with nutrition and sleep and exercise, activity. So those are things that we want to do. Is we want to have the body as strong as possible to fight off this illness, and there's things we can do to protect our immunity, and psychology is a way of us knowing what those strategies are.
We spoke to an expert last week who has done some research looking at a possible link between alleviating the symptoms of long COVID and vitamin B3 and zinc and quercetin, I think it's called. Have you come across this at all?
So that is something that involves enhancing your immunity, and you can enhance your immunity by taking zinc, certainly, some of the B vitamins, certainly, but it's also being hydrated, drinking lots of water or keeping yourself fluid. And also doing things like even, kind of making sure you gargle, with your throat several times a day, as well as your nasal cavity in terms of keeping that fresh with some types of saline solution. So there's lots of things we can do to enhance our immunity that protect us from COVID-19 and other viruses.
And hopefully depression as well.
And if you basically can escape having a chronic illness or a viral attack, you reduce your risk of having some type of psychiatric condition.
Professor Jason, thank you very much for your time. Really appreciate it.
Happy to help.
Before we go, it's quite interesting, this link between some illnesses and depression. Are you thinking that they sort of spark depression, or is it because the person is ill that they become depressed?
So there might be some individuals who initially were depressed, and then they have an extra burden of carrying a certain type of difficult illness like COVID-19 for the long haulers. But it's also very likely that, and I've talked to a number of these individuals, and we've talked to them and we have data on them, that people were fine and they were actually pretty healthy and pretty positive lifestyle. And you take away their lifestyle, you basically don't let them work because they're feeling sick, don't let them interact with their family because they don't feel healthy enough, and also reduce their reactions or interactions with friends. And truthfully, I would say it's almost amazing that more people don't get depressed when they have all those types of losses.
And then, of course, all the devastating financial consequences of COVID too, that must also feed into depression.
Of course, yes. If you lose your job or can't work or can't support your family, that's just one more stress. And we know that stress is very, very bad long term, because what stress does is it basically kills some of those neurons in your brain that you need in the frontal area for thinking and memory and other things that go on. But stress also increases the connections in the amygdala, which is the area of the emotions. So not only is your brain not able to function as well, but you have more emotional reaction under high levels of stress over long periods of time. So that's exactly why we want to reduce the amount of stress that people experience.
Well, thank you very much. I'm going to just see if I can, I'll stop